My name is Jason Brown. I'm a medical oncologist at University Hospital Simon Cancer Center in Cleveland, also associated with the Case Comprehensive Cancer Center. Today, I'm going to talk about the role of the ctDNA biomarker in bladder cancer. So first off, I want to discuss what is a biomarker. So often we use biomarkers in either detection of cancer or following cancer. A biomarker is a measurable feature found in body fluids, for example, blood, urine, or saliva, or tissues that might be a sign of a normal or abnormal biologic process. For example, in prostate cancer, we have something called PSA that we follow. But in bladder cancer, we don't typically have biomarkers that we can measure, that we can follow. A prognostic biomarker predicts outcomes. For example, if you're positive for this biomarker, how long will you survive? A predictive biomarker more so measures response to therapy. For example, if you're positive for this biomarker, will you respond to a certain treatment? So what makes a good biomarker? Well, first of all, we want biomarkers to be accurate, meaning that it's measuring what's actually seen in the body. For example, if we have a biomarker of bladder cancer and it's positive, we want to be sure that it's actually positive for bladder cancer and not detecting something else. We want it to be reproducible. This means that if we measure this biomarker, we want it to be the same every time. We don't want a variety of results because then it's not something that we can trust. We want it to be readily interpreted. What that means is when your doctor gets the result, your doctor understands what the result means. For example, if we have a bladder cancer biomarker and a result comes back as 6, but we don't know if that means if you have bladder cancer or if you don't have bladder cancer, then it wouldn't be as valuable. Or even if it's more complex, that can't be interpreted the same way every time. We also want biomarkers to be affordable so they don't break the bank. And finally, quick turnaround time. So you're not waiting for a result for too long of a time.